Welcome back to the deep dive. We're jumping straight in today, actually, with a really important topic, grief reaction.
Yeah, something that affects, well, pretty much everyone eventually.
Exactly. And we've got a set of revision notes here, that kind designed to be really high yield.
Mm.
So our mission really is to unpack these together, pull out the key bits of knowledge, help you get a solid handle on how loss is often understood, medically speaking.
And make it accessible, right? Take that dense info and make it useful for your understanding.
That's the plan. So these notes, they give us structure, which is helpful for revision.
Definitely. It helps frame such a complex human experience.
Okay, let's get into it then. The absolute starting point. What is grief reaction, according to these notes?
Right. So the core definition they give is that grief reaction. And they mention you might also hear bereavement or mourning. It's framed as a completely natural response.
Natural. That feels like the key word there.
It really is. The notes stress it's not an illness in itself. It's a reaction to losing a loved one.
Okay, natural. And it's not just feeling sad, is it? The notes talk about a whole spectrum.
Absolutely. Emotional, cognitive, behavioral, even physical reactions.
Yeah.
It's all part of how someone, adjusts to that huge change, that loss.
A whole person response, really.
Exactly. And another really key thing they emphasize is how variable it is. Hugely variable between people.
Right. No set timeline.
None at all.
Yeah.
And it can be lengthy, quite prolonged.
Yeah.
And that can still be completely within the range of normal.
Okay, so very individual, potentially long, which makes you wonder, how do we think about normal if it's so varied? The notes mention stages, I think.
They do. They bring up that classic model you often hear about: denial, anger, bargaining, depression, acceptance.
With 5 stages.
Yeah. And the notes say this could be a helpful way to sort of recognize potential patterns. But, and this is probably the most high yield point here,
Go on.
not everyone goes through all 5. And definitely not always in that order.
Ah, okay. That's crucial for revision, then. Think of them more like, I don't know, possible experiences. Guideposts.
Exactly. Guidepost, not a checklist you have to tick off line by line.
Got it. So, wrapping up the definition, it's natural, it's varied, involves the whole person and those stages. Useful framework, but not a strict rule.
Perfect summary. So if that's what it is, where does it stem from? The etiology section in the notes?
Well, the obvious one is the death of a loved one, right? That's the main focus.
Yes, that's primary.
Yeah.
But the notes do broaden it out a little. They mention that grief can also come from other really significant losses.
Like,
End of a major relationship, maybe a big life change like losing a job or your health, that sort of thing.
so it's about the impact of the loss itself, the hole it leaves.
Precisely. The emotional and psychological weight of that specific loss for that person.
And those individual things we mentioned earlier, personal history, culture, they play in here too.
Absolutely. The notes list personal history, cultural background, and importantly, the person's support system.
Yeah.
All big influences on how grief manifests.
Okay, so we know what it is, what triggers it, but if it's natural, how do we spot when it might be becoming, well, more difficult? Which I guess leads us straight to risk factors.
Risk factors for complicated grief reactions.
Yeah.
This is really key for identifying who might need more support.
What do the notes list?
Okay, so a sudden or traumatic loss is
Yeah.
a big one. Makes sense, right?
Yeah.
The shock element,
Yeah.
lack of social support, really crucial. A prior history of mental health conditions makes someone more vulnerable.
Okay.
Also, a complicated or maybe an ambiguous relationship with the person who died. That can make things trickier. And finally, just having limited coping skills generally.
So it sounds like a mix of things, how bad the loss itself felt and what resources, internal or external, the person had before the loss.
That sums it up well. And the notes specifically mention again that people with pre-existing mental health issues might face more intense or prolonged reactions. Spotting these factors helps guide support.
Right. Let's dig a bit deeper. What's actually happening inside us? Pathophysiology. This sounds complex.
It is complex. The notes describe it as this intricate interplay, emotional, psychological processes, but with physiological stuff underneath.
Like brain activity.
Yeah, they mention brain areas involved in emotion regulation, memory. They definitely play a role.
Any specific, chemicals involved?
Neurotransmitters. Serotonin and norepinephrine get a mention. They're key for mood regulation anyway, so it makes sense they're involved during grief.
Okay. But what's the main takeaway here? Because I remember the notes saying something about our understanding.
Yes, this is vital. The notes are very clear. The complete pathophysiology of grief is not fully understood.
Right. So we know bits, like brain areas and chemicals, but not the whole story.
Exactly. It's complex, still being researched.
Yeah.
We don't have a full A to Z biological map yet.
Okay, memory point. Brain involved, chemicals involved, but big picture, still unclear. It's complex.
Which kind of makes sense for something so, well, human and varied. So moving from the inside out, how do we assess this? Differential diagnosis. Why is this important?
Because, like you said, grief can sometimes look like other things, can't it?
Right.
Especially, say, clinical depression or anxiety disorders. You need to be able to tell them apart.
Precisely. You don't want to misdiagnose. And the notes give us the key things to look at for differentiation. It comes down to assessing three things: duration, intensity, and impact.
Duration, intensity, impact.
Yeah. How long have the symptoms been going on? How severe are they? And crucially, how much are they actually interfering with the person's daily life, their functioning?
Okay, so for revision, maybe think of it like a quick mental checklist. How long, how bad, how disruptive. That helps sort out if it's likely grief or potentially something else needing a different approach.
That's a really practical way to frame it. Good tip. Now, just to ground this, let's touch on epidemiology. The notes focus on the UK context.
And it's pretty straightforward, right? Grief is common, very common, in the UK, worldwide.
Yeah, exactly. The notes say prevalence figures vary depending on how you define things and who you study, but the main point is just how relevant this is. Loads of people in the UK will experience the death of someone close.
Makes understanding it really important, practically speaking. Okay, let's get to the heart of it. Clinical presentation. What does grief actually look like? What are the signs and symptoms?
Well, the notes list quite a range.
Okay.
Emotionally, you've got sadness, obviously emotional pain, feeling empty inside. There can be disbelief, denial initially, guilt, anger too. Those are common. Cognitively, difficulty concentrating is a big one.
Yeah, I can imagine.
And then physically or behaviorally,
Hmm.
sleep problems, changes in appetite, feeling exhausted, even things like headaches.
Wow, okay, so it really does hit on every level. Sadness is just one piece of a much bigger puzzle.
Totally. And again, the notes stress.
Hmm.
It varies hugely from person to person. But they also introduce something specific here: atypical grief reactions.
Atypical. What makes them different?
They sort of fall outside the most common patterns. The notes mention they might be seen a bit more often in women, and especially after sudden, unexpected deaths.
Ah, linking back to those risk factors.
Exactly. And things like a problematic relationship before the death or not much social support, those also increase the chance of these atypical patterns.
Okay. Are there specific types described?
Yes, two main ones highlighted. First, delayed grief. This is where the main grieving process doesn't really kick in until, say, more than 2 weeks after the loss.
So a lag period?
Kind of. And the second is prolonged grief. Now, the notes admit defining prolonged is tricky, but here's a really important point they make.
What's that?
Normal grief reactions can sometimes extend beyond 12 months.
Wow, okay. That's a nuance you could easily miss. Normal grief can be long.
It can. So, thinking about clinical presentation for revision, remember the broad categories: emotional, cognitive, physical, behavioral. Then think about those atypical types: delayed, starting after 2 weeks, and prolonged, which is fuzzy, but normal grief can last 12 months.
Got it. That's a super helpful summary. Now, if you're seeing these signs, how do you formally diagnose it? Let's talk investigations.
Right, and the notes are incredibly clear on this, probably the simplest section.
Which is?
No specific investigations.
Yeah.
0. There's no blood test for grief, no brain scan for bereavement.
Okay, that's a massive takeaway for anyone studying this. Diagnosis is purely
Clinical assessment, a thorough one. It means taking a detailed history, really listening to the person describe their symptoms and how life is affected. And importantly, considering their cultural background, their individual situation. It's all about the conversation.
Right, so memory tip, forget tests. Diagnosis, clinical conversation. Simple as that.
Pretty much. So if it's diagnosed clinically and it's seen as natural, how is it managed? Let's look at management, again with the UK context from the notes.
The overall vibe seems to be supportive care, doesn't it? Not treating it like a disease, but helping the person through it.
Exactly. Providing resources, maybe some coping tools, helping them navigate their own process.
Are things like therapy mentioned?
Yes. The notes suggest psychotherapy, like specific grief counseling, or maybe CBT, cognitive behavioral therapy, can be beneficial for some people.
Okay. And other types of support.
Community resources are highlighted. Things like support groups, self-help techniques, accessing local services, all part of the UK approach.
So for management, we're thinking general support, specific skills or resources, and therapy options if needed, kind of like pillars of support.
That's a good way to think about it. So it's the usual outlook. Prognosis.
The notes say, generally, symptoms tend to lessen over time. It's a natural process expected to ease.
But, and here's that theme again, huge individual variability. How long it takes, how intense it feels, differs massively.
And that links back to things like support systems, coping skills, right? They influence the prognosis.
Absolutely. All those factors we discussed earlier play into how someone's journey unfolds. So the general outlook is improvement, but the path is very personal.
Okay. Finally, the notes cover potential complications. Because while grief is normal, sometimes it can become stuck or lead to other problems.
Exactly. This is where we might see those prolonged or complicated reactions really taking hold. The notes list potential issues like, well, persistent, intense grief that just doesn't ease up, developing actual clinical depression or significant anxiety, withdrawing socially, maybe turning to substance abuse, and generally just significant problems with day-to-day functioning.
So these are signs that the natural process has perhaps tipped over into something more impairing.
Precisely. And that's why understanding risk factors and spotting atypical signs early is so vital. The notes stress how important it is to monitor people who might be at risk and offer the right support or intervention to hopefully prevent or address these complications.
Right. It all ties together. Understanding the norm helps you recognize when things might be deviating and need more attention.
Absolutely. It brings the whole picture together, from definition right through to potential problems.
Okay. Wow. That was quite a journey through these revision notes on grief reaction. We went all the way from the basic definition, natural, varied response, through triggers, risk factors.
Yeah, pathophysiology, or what we know of it.
Yeah.
Differentiating it, how common it is.
The wide range of clinical signs, including those atypical forms, the fact there are no specific tests.
Management approaches, the usual prognosis, and finally, those potential complications.
It really paints a picture of something universal, yet so deeply individual.
It certainly does.
Yeah.
It requires careful navigation and support.
Definitely. And maybe the final thought to leave you with, something to chew on from these notes, is that tricky line between normal, lengthy grief and prolonged or complicated grief.
That point about normal grief lasting potentially beyond a year.
Exactly. It really challenges any simple timeline, doesn't it? It forces you to focus less on the calendar and more on the intensity of the symptoms, the impact on the person's life, and their individual context.
It really pushes for a more nuanced, compassionate view when supporting someone grieving.
Couldn't agree more. Well, we hope this deep dive into these particular revision notes has been really high yield for you, giving you a clearer picture of grief reaction.
And if you are looking for more revision support, the material we discussed today is based on resources you can find over at passthemsra.com.
That's passthemsra.com. And they also have free practice materials available too.
Yep, check out freemsra.com for those.
Great resources. Huge thanks for joining us on this deep dive.
Thank you.
Till next time.